This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. So basically, I was a bit surprised, but then when I spoke to you, that you were available 24 hours a day, 7 days a week. But that's the truth. You've got a mobile number, which we'll put on our page for you. And I would recommend anybody that's not getting what they want in terms of support from their clinic, want extra support, then Natalie's there.
Yeah.
That would be, I see it as a great service.
No, thank you. But yeah.
Anything else you want to say, Nat?
At the moment, we've gone through who's contacted and our gaps. Do you have any other questions for me?
One of the areas I have a particular interest in is miscarriage, and so even IVF sounds like it's going to be, you're pregnant, you get your positive pregnancy test, and you're safe. You're going to have a baby at the end of the day. Well, that's actually not true. But from an IVF cycle, obviously it's age dependent. But if you haven't had genetic testing of the embryos, then your odds of a pregnancy loss are just the same as if you'd had a normal pregnancy. So I personally, when I've got patients that have got pregnant, I make sure I see them on a fortnightly basis all the way through to 10 weeks, by which time, if we see a heartbeat at 10 weeks, we're 98% certain there'll be a baby at the end of the day. But I think that piece of reassurance is important. And I'm sure that, I have phone calls from patients in the middle of the night, because at the Life Fertility Sydney, the doctors are the people on call.
They're on call.
And, do get, oh gosh, I've started bleeding, and then dealing with that over the phone and then following up the next day is important. But that's not a service necessarily offered by all the other clinics. And I can see a role for you being the point of call, at least as a reassurance.
Yeah, no, absolutely. I think one thing I probably would say as well is that I do think there is a little bit of a slight shift in sort of the fertility landscape now and how things are changing, and that I think we're often leaning, and we've sort of touched on it before, that sort of more personalised, patient-centred care. So I think, a lot of the time will be focused on sort of those like clinical outcomes. And I think, look, obviously that's incredibly important within itself. But I think, patients are also looking for that continuity, accessibility and personalised support throughout. I think that's incredibly important. Fertility treatment is incredibly sophisticated medically, but it's also, again, as we've touched on before, incredibly emotionally significant experiences that people ever go through in their lives. And patients are wanting to kind of understand what's happening. They want to feel informed, they want to feel heard, and they want to feel supported, not just during that sort of appointment times, but as we were saying, in those sort of critical moments between the appointments, late at night when they're going through Dr. Google. And I think, healthcare as a whole is increasingly recognising that patient experience does matter alongside of that clinical outcome. And to me, that's where I think fertility care is really evolving, and not just treating the cycle, but actually supporting the patient going through it as well. And I just think that's really important.
All right. Okay, well, thank you very much for coming on to the IVF Journey.
Thank you.
As I said to you yesterday, we've got over 500 episodes, and I'm sure referring patients to that, if they're, as 99% of people in the fertility age group now are into social media.
Very true.
I'm pretty sure that it would be of a help to some of them. So that's something else you could be telling them about the IVF journey.
Yeah, no, absolutely. Well, thank you so much for having me. It's been an absolute pleasure.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.